As we get older, America is likely to face a shortage of doctors, but basic clinics at chains like Walgreens and CVS are trying to fill the gap. Dr. Kavita Patel is an internist at Johns Hopkins Hospital and a senior fellow at the Brookings Institution. Welcome.
Welcome. Thank you for having me.
What's the issue here?
So the issue here is that people are finding these clinics as real convenient options. About 40% of Americans live within a 10-minute drive of one of these clinics. And you can go, get your condition seen, and then go out into the aisles and buy your drug that you might need or any supplies.
Walgreens has announced they are expanding these clinics. People have been using them for a long time for sore throats, common cold, sort of those types of visits to get a flu shot. Now, however, these clinics say they're going to treat much more serious diseases.
That's right. So part of the expansion has been threatening to some doctors. Even clinics like myself, the one that I practice in, have thought this could be a replacement. But up until now, as you mentioned, Nora, they've really just been for straightforward conditions.
So you think they're good or bad?
So they're good for certain things. I think if you do have a very straightforward condition, when people have looked at the quality of care for the treatment of sore throats, ear infections, urine infections, they've found no difference between retail clinics and your regular doctor's office.
So how do you know when you should go or not go to a retail clinic?
The key for patients is to know that if you have something that requires more chronic management or seeing a doctor for follow-up tests, then you might want to make sure you're going back to your primary care physician. And also keep in mind that most of these clinics are staffed by advanced practice nurses and not physicians.
And when you say more chronic diseases, you mean like diabetes, heart disease?
High blood pressure, high cholesterol, some of the very basic chronic conditions. We're doing something at Hopkins where we're partnering with Walgreens in the community so that when people are seen with these chronic conditions, they can actually then be seen in our clinics if they need to be better coordinated.
Are they actually cheaper to use them?
They are cheaper to use. A study by the RAND Corporation looking at 3 conditions, ear infections, throat infections, and urine infections, found that going to a retail clinic can be 30% cheaper than a regular doctor's office and up to 80% cheaper than an emergency room for those conditions.
All right, Dr. Kavita Patel, good to see you.
Thank you for having me.